Hello, friends. We're going to continue our discussion about anxiety spectrum disorder. Last time we talked about panic disorder as being one of those disorders that are included in anxiety spectrum disorder. Panic disorder involves multiple panic attacks, but there is no real explanation for them. These panic attacks usually happen without warning, and they're not due to any kind of mental health disorders or any other medical conditions. That's how we distinguish panic disorder from panic attack. Panic attack occurs alongside either different forms of anxiety disorders, mood disorders, substance abuse, or some other medical disorders like hyperthyroidism. We will discuss more about hypothyroidism in a different video. Panic attacks are abrupt surge in intense fear or discomfort. It will reach its peak within a few minutes, and then it will resolve. Whereas when you have multiple panic attacks and there is no other known medical condition causing it, or no other psychological condition causing it, then we could call it panic disorder. This is a very complex subject, and we're just looking at it very basically. There is a difference between panic attack and anxiety attack. The main difference is that certain stressors trigger anxiety attacks, and they may build up gradually. In contrast, panic attacks typically happen without any kind of expectation. So they happen very unexpectedly and suddenly. So that's the main difference between having a panic attack and having an anxiety attack. Anxiety attacks will be less severe, but they will last longer. There's something called gunas of Vata dosha. Gunas are basically qualities of Vata dosha. Guna of Vata, or the quality of Vata, is light, dry, cold, rough, mobile, clear. You could see the same qualities manifesting during a panic attack. The symptoms: rapid heart rate, pounding heart, chest pain, shortness of breath, difficulty breathing. There could be sweating, there could be numbness and tingling of the hands and feet, lightheadedness. Some people may even feel chills, trembling, tight muscles, dry mouth. These are all very much symptoms of Vata dosha. So the chala quality of Vata dosha causes movement, and these movements could be in the form of trembling, tachycardia, which is heartbeat more than 100 per minute. Vata dosha can also affect different vayus in the body. These vayus, when they're affected, they will cause difficulty breathing. When the Vata dosha is in the Majja Dhatu, the nervous system, this will cause nervousness, anxiety, trembling. If someone is deficient in magnesium, they can manifest some of the symptoms shared by anxiety spectrum disorder. Magnesium is a muscle relaxant. It will loosen the grip of Vata dosha on the nervous system. Magnesium is known to decrease anxiety. Magnesium will block the sympathetic nervous system from affecting the heart, and this will combat some of the symptoms caused by anxiety spectrum disorder. In the next video, we could go a little more into the traditional Ayurvedic herbs that could be used to help with anxiety disorder, panic attacks, and anxiety attacks. I hope this video was helpful. We will continue our discussion on anxiety spectrum disorders. Keep in mind, this is a very complex subject, and it's best to take medical advice for treatment of these conditions. Feel free to get in touch with me if you would like natural approach which will go hand in hand with your medical treatment for anxiety disorders.